Good afternoon. This is Dr. Havens with our Week 2, Unit 2 Leadership recorded lecture. We are covering chapters 4, 5, and 6 this week. We'll begin with chapter 4, Leadership and Followership. Our objectives are to define the terms leadership and followership, to discuss the importance of both of these roles for new nurses, and to define the qualities and behaviors that contribute to effective nursing leadership. How do we define nursing leadership? Many people use the terms leadership and management interchangeably. However, they are qualitatively different. Management refers to authority or an authoritarian position that one is given, and leadership has to do with influence. Influence is gained, it's not granted. Successful nurse leaders are those that know how to work together. They know how to do teamwork effectively in order to achieve common goals, which is usually effective patient care, quality care. Leadership is a broader concept than management. Although managers do need to be good leaders, management in and of itself specifically focuses on achieving the organizational goals. For the hospital, that's the mission and vision statement. For any healthcare facility, it's going to center around quality care and evidence-based practice. It's also important to point out that sometimes people who are in leadership are not in management. There may be an identified or a designated person in the management position, but sometimes the person who is influential in getting things done may be someone who's been there a long time, who's easy to get along with, somebody who has really good people skills. And this is the go-to person. Everybody knows someone like this in your workplace. This is not unique to the nursing profession or to healthcare. But sometimes there are influential people who are the problem solvers and the good listeners, and this may or may not be the identified nurse manager. So I think it's just important to make that distinction. So there are 3 important competencies or qualities of effective nurse managers. One is the ability to define what's the situation you're in and what do you want to influence or change. What have you got versus what do you want? What do you want to see happen? Adaptation is another important competency, and this is the ability to make changes that close the gap between what you've got and what you're hoping to achieve, or between what you've got and what you want, how things are and how you want them to be under your leadership. And then the third competency that's important in effective nursing leadership and management is great communication skills, both written and verbal. So there are a lot of different theories about what makes a good leader and how does someone become a good leader. Some people believe that good leaders are born and not made. This is probably not true. I think research has shown that everyone has to go through a process of learning how to become a leader and developing leadership skills. You can either do it by taking college courses on leadership and management in your curriculum like you're doing now. You can be mentored by working under those who have proven effective leadership skills, or maybe a combination of both. But we don't exactly know. There's no definitive answer to the question right now about what makes someone a good leader. There are, however, some traits that have been identified as being part of effective leadership: management of attention, management of meaning, management of trust, and management of self. In terms of management of self, what does this mean? Effective leaders know themselves and they know their strengths and weaknesses, and they are aware of their Let's talk for the next few minutes about 3 different types of leadership styles that you can read more in the textbook, page 59 and 60 if you like. Autocratic leadership, also called authoritarian or directive, is a little bit maybe like the military. There's a definite chain of command. The leader gives the orders and makes decisions on behalf of the group. When there's a decision to be made, this type of leader says, I've decided that it's this way, this is the procedure that we're going to follow, and this is how we're going to solve the problem. So this is a very efficient way to run things, but it can kind of squelch employee creativity and problem-solving skills, and it's also well known to reduce nurse motivation to take initiative and that kind of thing. So more control communicates less trust, and therefore it can decrease the morale of the nursing team. The second type of leadership style we're going to discuss is called democratic or participative leadership. So democratic groups are run on the consensus model. Usually there's a vote or an agreement and the majority wins. So in this type of nursing unit, important plans and decisions are made in conjunction with the team and not just by the nurse manager. So this is a little bit of a less efficient way to run things because it's going to involve a lot more meetings and discussion, maybe emails and that kind of thing. So it's going to take longer to get a problem solved. But it usually increases nursing motivation and creativity and problem solving. People feel that they are given input. They have permission to think, speak, and act, and this can bring out the best of people and actually in the long run make them more productive and not less. The third leadership style is the laissez-faire or non-directive leadership style. In this one, the nurse leader does very little planning, not a lot of decision making, doesn't tell people what to do. It's could actually be defined as a lack of leadership. For example, when decisions need to be made about how to solve a problem, this leader may postpone making the decision or may never actually reach a decision at all. In most cases, they would leave people feeling a little bit confused and frustrated because there's no clear goal, no clear direction, and no direct guidance. So employees who do well under this type of management system are very self-motivated and mature, probably very experienced nurses, so they actually need little direction. But many nurses actually would flounder under this kind of leadership. So in some cases, it's not so good. Let's talk for just a minute about transformational leadership. This is the type of nursing leadership that is practiced in every magnet hospital throughout the United States. Transformational leaders create meaning and inspiration, and they articulate a vision of what's going on in the healthcare facility. They are very good at motivating employees and giving them a sense of optimism and mission and looking at the bigger picture. It goes beyond just an appropriate reward for a job well done. People, caring for the sick and is the goal of the profession, the good of humanity. Most people choose nursing in order to do something good for humankind, and this is their vision. This is the vision of transformational leadership. So, transformational leaders like to motivate people. They communicate their vision in a manner that's so meaningful and exciting that it reduces negativity, it engages nursing staff really well, and it inspires people to the commitment to do their very best. Transformational nursing leaders help their employees to be all that they can be, to use the old slogan from the Army, or they inspire people to be their best. So next, let's talk briefly about the caring leaders. People who use the caring leadership style are employing a combination of servant leadership and emotional intelligence, both of which we'll talk about in Chapter 5. So behaviors of caring leaders include respecting their coworkers as equals and individuals. They tend to listen to other people's opinions. They give them full consideration. They are aware of both theirs and others' feelings. They're very sensitive to this, and they emphasize with the nurses who work for them. They try to understand their employees' concerns and needs. They are really big into staff development, so they make arrangements for the nurses to continue do continuing education and attend webinars, conferences, and workshops. And they also do presentations to help them keep abreast of the latest findings and the latest evidence-based practice related to nursing care. And these leaders are very competent both in leadership and clinical practice. Chapter 4 outlines about a dozen essential qualities for effective nursing leadership, including self-awareness. This goes back to the emotional intelligence, being aware of what you're thinking and feeling. Also, being able to handle stress is an important quality of an effective leader. Keeping a balance, kind of a work-life balance, being generous with employees, with your time, with praise, with promotions, being optimistic, being a high energy person. They need to be able to take initiative in order to be an effective nurse leader. They don't sit back and wait for other people to take the initiative and solve the problems. Having a positive attitude, having integrity and courage. These are all parts of being a really effective nurse leader. And the behaviors that we would expect to see in an effective nurse manager or leader include communicating the vision for the future, as we've said. What's in the 5-year plan for this department or for this healthcare facility? What do we want to see happen? What would we like to see different in 6 months or a year or 2 years? Good communication skills, as we've said, both verbal and written. They have the ability to value and respect the individual employee. They're good at critical thinking and problem solving, and they are excellent at priority setting. What needs to come first? Let's talk briefly about followership and leadership. These roles go hand in hand. Without followers, you can't be a leader, and vice versa. So it's important to be a team player and a follower. In most of our roles, most of the time we are followers. Occasionally we are all leaders in some form or fashion. We are followers when we are a staff nurse on a nursing care unit, when we're attending a class, when we're a student, when we're in a meeting, or when we're a member of some team, whatever it is, we are being followers. So it's important not to underestimate the value of being a good follower. So valuable followers are self-directed, they're skilled employees, they actively participate in helping to determine the group's direction, they advocate for new ideas, they use critical thinking skills, and they use their time and energy to invest in the work of the group and what we're doing here, better patient care. So what would this look like? A good follower would be one who expresses ideas about ways to improve patient care. Maybe they come in early, maybe they relieve other people for breaks, maybe they take on tasks without having to be asked. So these are examples of what a good follower looks like. Being a good follower makes the leader's job easier. So what things can we do to become better followers? We can be good listeners to what our leader or the manager says. We can continue to learn as much as we can about our specialty area to refine our expertise and clinical skills. We can be supportive of new ideas expressed by others. And when we disagree, we express ourselves professionally and explain why we disagree. We devote a lot of our energy and time to the work. If we discover a problem as a good follower, we want to notify the nurse manager right away, and even better, we want to include a suggestion for solving that problem. We want to be a good solver.